All right, so Dr. Bill Wiley here. I'm the guinea pig patient. Dr. Thenappan is going to show me the proper way to put an eyelid holder in place to avoid things like corneal abrasion. Please don't give me a corneal abrasion. Things like meibomian getting squeezed out, bacteria getting introduced, slit flaps. Thank God I don't have a flap, but I just don't want a corneal abrasion. So
most important thing here is patient cooperation. So Dr. Wiley has taught me a lot of things about surgery, and I think looking back, there's a reason for every single step, the way that he teaches me it, and it's clear that he sort of thought through all of the different ways of doing these things. And so even though like putting in a lid speculum might seem like a fairly routine thing, there's a lot that can go into it that can make the rest of your case a lot easier. Yeah, here we go. So the first thing you do is, numb your eye. So we have a lid speculum here. When you go to put it in, you don't want it to be, the jaws to be too closed like that or too wide. You want to start where it's maybe the two are just touching or a little bit more. And then you want to start with the upper eyelid because the eyelids are a little bit looser nasally. So you want to start nasally there. Have the patient look down, and then you're going to very carefully slide in from the nasal side. See how I'm not even close to the cornea? And then look up for me. And then you're going to pull the lower lid down, slide the bottom guy in there, and then you can very gently open those two wires. And then when you go to release and take it out, you again want to gently bring those two jaws closer together. Start with the lower lid. So you're going to pull the lower lid down, take that out, and then very carefully slide out nasally again. And that provides for the most atraumatic, smooth insertion and removal of your lid speculum.
So that's cool. So I think a couple of the points are in and out nasal. So going in and out the nasal, it's counterintuitive. You'd think you'd go temporal, but the temporal canthus gets a little tight and the lid speculum can get like locked in temporal versus open nasal. You can slide in and out nasal easier than it would be temporal. Also, the upper lid's kind of always a slide and the lower lid's always kind of a pull down. So it's like slide in, pull down and put in, and then pull down, slide out.